Welcome to Dr. Colbert's Divine Health Podcast. Hi, I'm Mary Colbert.
And I'm Don Colbert.
And we have got an amazing show for you. In the next 30 minutes, Don is going to be covering something that affects us all.
Or most of us. In fact, it's sluggish thyroid. And especially after age 50, both men and women, there's about 50% of the patients I see, and sometimes as high as 60%, have a sluggish or a low thyroid. And you say, well, how do you know? Well, I check everyone's thyroid hormones. And what I find, and when I first see patients, I always check their temperature. And it's interesting that those people with a sluggish thyroid or low thyroid generally have a lower body temperature. It's usually a little less than 98 degrees if we check them orally on their forehead. But also I notice when I shake their hands, now I know during COVID we haven't been shaking hands, but usually I could walk in a room, shake someone's head and say, oh, I see that your thyroid is sluggish. And I've never seen them before because they have these icy cold fingers, icy cold toes, and they're missing usually the lateral or the outside half of their eyebrow.
I have to tell you, Don, we'll be sitting in an airport, which we are in an airport quite a bit. And I will see you looking, going, you see her? She's got low thyroid. You see him? Oh, he
Or
has...
not necessarily low, sluggish. It may not be low because the numbers don't always tell the true story. And that's why doctors are focusing on numbers, but we focus on symptoms with the numbers.
Right, but you were just watching a program and you saw a man with real bushy eyebrows and you went, oh, he didn't have a thyroid problem.
Well, I noticed he was elderly in his late 90s, and he had nice bushy lateral eyebrows, and he was real slender. I said, oh, he's got a healthy thyroid most likely.
Yeah, so whenever you meet Dr. Colbert, you know he's doing a visual examination of you immediately.
I can tell if you usually have a back problem or a knee problem or a hip problem. I say, look, Mary, see that person right there? They're wearing their hips out. They're waddling. That's a sign that they're going to need a hip replacement.
No,
or I'll show Mary. I said, look, Mary, I wonder if that person knows they have Parkinson's. The way they're walking, there's no arm swing. They're shuffling. That person's got Parkinson's. I wonder if they know about it. So sometimes Mary goes up and asks them, hey, did you know you have Parkinson's? No, I didn't. My doctor didn't tell me that.
I said, well, you might be checked. You might want to get checked for this.
And there we go. We're going off the subject. We're talking about sluggish thyroid or low thyroid.
Now, Don, a lot of people go to their doctors and they say, you know, I had a blood test and the doctor told me my thyroid's normal. Let's start there.
Yeah, let's start again. That's why when you go to your doctor, most doctors, 95% will just check one test to screen for your thyroid, and that's your thyroid stimulating hormone. That checks the pituitary. And if it is low, that number is high, which is greater than usually 4.5. And if it's hyperthyroid, it's usually real low, usually less than 0.45. And so that's the number they go on. But what we find is so many patients have sluggish thyroid, and they don't have low thyroid. You see, most causes of low thyroid or hypothyroid is Hashimoto's thyroiditis, which is an autoimmune condition. So every patient that comes in my office, I do a full battery of hormone tests, blood tests, but my thyroid test I start with is the most accurate, which is the free T3. The free T3 tells us the active thyroid, and the T3 is the most active form of thyroid, and that's if our body's free T3 is low or sluggish, you generally have a sluggish metabolism, cold hands, cold feet, brain fog, you're starting to lose your outer eyebrow, and all of these other symptoms generally come on. So I'd like to list these symptoms, but that's the main test. I'll list them in just a minute, but that's the main test is a free T3. Very few doctors ever check it. I also check the TPO or thyroid peroxidase antibody test to see if you have Hashimoto's. Now,
and that's
TPO.
TPO.
Autoantibody test. Yeah, TPO. And doctors rarely ever check that, even endocrinologists. And, of course, I check the TSH, and I'll check the T4, which is the inactive form of thyroid hormone. And then sometimes if people are still having symptoms, I'll check the reverse T3. And those are the key tests. But
let's talk about the symptoms.
Okay, the symptoms are the key because there's a lot of vague symptoms that people have. and they may think it's their thyroid, but the main symptom of low thyroid is you have a sluggish metabolic rate. And so these people tend to gain weight, and they have a characteristic type of obesity where it's different from people that have just belly fat, but it's kind of a generalized obesity, and they many times have edema or swelling in their face, also sometimes in their hands. Their eyelids generally swell, especially if they're low thyroid. But the main symptoms are they get this downturned mouth. When women get, especially in women, when they get to be about 50, they get this real sad look on their face where their mouth is downturned. And what I do is I put filler in them and I fix their thyroid. But I say, I'm going to wipe that frown right off of your face.
I think you've said that to me a couple of times.
Right, I do it to you too, because you have low thyroid,
Right.
and we have you on thyroid, but sometimes the low thyroid gives you a downturned mouth where you look sad all the time. I can spot these people from a distance. And again, if you wait too long, you're going to need some filler to fix it, but we put them on some natural thyroid, and I'll talk about natural thyroid in a minute. A little facial filler, fill in those marionette lines, and boom, they're good to go generally. But other symptoms are dry skin, especially on the hands, the feet, the elbows, and the knees. The skin gets real dry in those areas. And then they get droopy eyelids, kind of like a hound dog, okay? They get that hound dog look. They have cracked heels. If you're having cracks in your heels, that's another sign, as well as constipation. And because thyroid speeds your metabolic rate up, and it helps your colon undergo peristalsis to eliminate its waste. But those people with real low thyroid, they almost always get constipation. The biggie is cold intolerance. These people hate the cold. They hate it. You see them if they're, and a lot of them are here in Florida where I live, but if they're up north, you always see gloves on their hands or warm socks at night when they go to bed. They always have a house coat on. They have about 2 or 3 thick blankets on the bed.
So they have a tough time staying warm.
Yes, a real tough time. They're always cold. And then they get these brittle nails. But the biggest thing is that the hair gets real thin. It breaks off. They get this thyroid hair, I call it. And the thyroid hair is just fine and wispy and breaks real easily. It doesn't come out by the root. It just breaks off. It's just fine, wispy hair. And once I start these women, or usually it's women, but men too, the hair starts to get thicker and coarser once I put them on the natural active thyroid. But also many times they start to get earwax, more earwax than normal, as well as one of the biggest is fatigue. These people are tired. And this is one thing I usually see when I start these patients with low thyroid or sluggish thyroid on the active form of the thyroid. All of a sudden, their energy usually increases rather dramatically. Not in everyone, but a lot of my patients. And then I tweak it up till I get them into that what I call sweet spot, to where they really feel good and their energies are being restored. But then other common symptoms include in women, especially younger women, they have a hard time conceiving. They have infertility. They also have menstrual irregularities and miscarriages. I cannot tell you how many patients that have come to see me with infertility issues, and they usually have sluggish thyroid. I put them on simply, a normal dose for them of natural thyroid hormone. All of a sudden, they're able to conceive. And we've had hundreds of women over the last 35 years this has happened to.
I think, Don, that's a really important fact right there with women who struggle with
Yes.
infertility.
Huge.
Now, is that something that
Doctors miss it most all the time.
you're kidding?
They have been to fertility specialists. They come to me. I check their thyroid, and it's usually sluggish. I put them on that little bit of natural thyroid hormone, and it's amazing how many of these women are able to conceive. But one of the biggest issues we see with low thyroid, weight gain. Weight gain, because realize your thyroid hormone, the active thyroid hormone, helps boost your metabolic rate. As we age, our metabolic rate eventually gets more and more sluggish, and literally we put more and more pounds on. And my patients that are on thyroid hormone, the active form, when I start them at a good, before the thyroid crashes and burns, these people maintain their metabolic rate. They maintain they're slender and healthy looking. They're able to exercise. They have energy, and they feel so much better. It actually helps. Thyroid hormone helps a lot of people with depression too.
Now, Don, what are some of the things that's interfering with our thyroid production? It's this little bitty organ. It's right
Yeah.
there in our neck.
Yeah.
And I didn't know it was responsible for so much.
Oh, Mary, the thyroid is like the master gland, the master metabolic gland. It keeps our metabolism going, and so many people are so sluggish and tired and obese, and it's because their thyroid is sluggish. But the reason we're seeing so much now is because of a lot of these endocrine disrupting chemicals that we're exposed to. For example, look at triclosan. Now, triclosan has recently been banned in soap. It was in most all the soaps for, since, 50 plus years probably. But now it's still in shaving gels and deodorants, even toothpaste. And triclosan interferes with your thyroid hormone, as well as pesticides. Just one example is DDT. We know that DDT and a lot of other pesticides interfere with thyroid hormones. Now, DDT has been banned since 1972, but we still import produce from other countries that still use it. And DDT and its metabolite DDE are in a lot of this produce that we're eating, and it's messing with our thyroid hormones. So there's lots of other chemicals out there that interfere, especially with thyroid, testosterone. They boost estrogen. That's why we're seeing such a hormonal crisis in this country, and that's why I wrote the book, The Hormone Zone.
I know that book is so full of so much information. There's no way in these podcasts we're going to be able to cover everything that Don wants to educate you about. So you really need to get a hold of this book, The Hormone Zone. And you can also get this book anywhere books are sold, and also from our website, drcolbert.com. And when you go to our website, we also have on the website the hormone. It's called the Thyroid Zone supplement.
Well, these are just natural supplements that help to support a healthy thyroid. And a lot of people don't need meds. They just need a supplement. And I've had reports of so many patients that have these symptoms. They're tired, they're sluggish, they're losing their eyebrows, they're cold all the time, they've got the dry skin, the constipation, the brain fog. And they get on the Thyroid Zone, which is simply supplements to support a healthy thyroid, and they're able to come out of the thyroid mess that they're in, and they're starting to feel normal. Their energy is coming up. Their brain fog is going away. They start to have the healthy thyroid function they're supposed to have.
I know this one patient, I was listening to her telling the staff, I overheard her talking, and she said, since I've been on Dr. Colbert's Thyroid Zone supplement, she goes, I can't even begin to tell you the difference in my mood. I used to really feel so depressed and felt so down and just kind of a hopeless feeling. She says, I will never go without this supplement. She goes, I feel more optimistic. I feel hopeful. And she goes, my mood has completely changed. I just don't feel hopeless and sad. I was like, amazing.
I know this lady was in her 70s, and the doctors wouldn't put her on thyroid hormone because her numbers were not as low as they wanted them. But she had all of these horrible symptoms and depression. And she said, I worked up to actually 5 a day. She needed a high dose, 5, which is unusual, but it literally helped her tremendously.
It's amazing. So go to drcolbert.com. That's drcolbert.com, and you can get a hold of our supplement and the book. Okay, Don, let's talk about some of the things that benefits from what we can do to help our thyroid. People want to know, okay, I've got sluggish, I've had the blood test. What can I do?
Well, again, a healthy diet, first of all, getting adequate sleep, controlling your stress, all of these things will help, because we now know that if you're under a lot of stress, high cortisol inhibits the conversion of T4 to T3, your active
no wonder
thyroid hormone. Exactly. So we're America's stressed out. We're producing huge amounts of cortisol, which is blocking the conversion of T4 to the active T3. So we are messing ourselves up. The more stressed we're under, the less sleep we get, the more foods we eat that are stressing our bodies. It's literally creating, as well as the hormone disruptors we're exposed to, it's really, and as we age, we generally are less able to convert the inactive form of thyroid to the active form. So everything's working against us as we age, as we get stressed, as we take medications. It can interfere with thyroid. So let's talk about the natural thyroid hormone versus the synthetic.
Good.
Now, one thing, a word of caution, if you're older, if you're over 65 or 70, we have to be real cautious because the natural thyroid hormone it's the natural desiccated thyroid, comes from a pig. You say, a pig? Why a pig? Well, because the pig's thyroid is most like the human thyroid. The thyroid gland from the pig has the perfect ratio, just like a human, of T3 to T4 of 1 to 4, which is the exact same as in your body. That's the exact same ratio we need.
So what do? They extract this hormone from the
thyroid of the pig. It's
Wow.
natural desiccated or dried thyroid from a pig. And you say, well, wow, that's kind of nasty. And now my Orthodox Jews will not take that. So what I do is I take the T3 synthetic with the T4 synthetic, and we have my pharmacy produce it in a sublingual tab so that they're getting the active form with the inactive form. But most people just take the inactive form of thyroid hormone. That's all their doctors prescribe, over 95%.
Wow.
And that's the levothyroxine or Synthroid. It has only T4, which is the inactive form of thyroid, but no T3, which is the active form at all. Now, here's what the natural desiccated thyroid hormone contains. It contains T1. See, it has 5 different thyroid hormones. T1, now T1 is not as active as T3, but it is somewhat active. T2, it has T3, T4, and calcitonin, all the different thyroid hormones that your body needs. And it's in the correct ratio, so that's why it's so good. But for those people that are over 65 or 70, especially those that have heart issues, for some, it can cause the heart to beat too fast. So we have to start real low and go real slow for them, because if you get palpitations, you're taking too much, or we have to slowly wean you up to the right dose. So that's the word of caution. But once we put these patients on the thyroid hormone, it's absolutely amazing how so many of these symptoms start to subside, especially that energy, and especially we start to see them grow their eyebrows back, their wispy hair, their thin hair starts to thicken up, which my women love. And when I combine the other things that help their hair, such as some women need a little micronized progesterone, some need our collagen, which helps support natural hair growth. It's absolutely amazing. Some women have just too much dihydrotestosterone, and dihydrotestosterone causes your hair to come out, so I'll block it. And my women, I just had a woman in my office this past week, and she's a low testosterone woman. She has to she comes down from up north every 4 months to get her testosterone pellet. Well, she had developed some hair loss from her testosterone, so we blocked it. We put her on our collagen and a little thyroid. She now has the thickest head of hair. Everywhere she goes, everyone comments, you have the most beautiful, thickest head of hair we've ever seen. This woman's 60 years old. But when she comes, it's just remarkable how beautiful and thick her hair is. But hers came from too much dihydrotestosterone and a sluggish thyroid.
You know, I think the mystique that people have is that all doctors know the same thing. That, they go to a doctor and then, well, he didn't tell me this, and he didn't know that, or why didn't he tell me? I mean, that is probably the biggest comment I hear from people when they listen to you and go, why didn't my doctor? And it's real simple, folks. Not all doctors are created the same. They don't all know the same thing. They've spent their time learning or researching different areas. And what Don has done is he has literally developed his whole life to researching and studying the best health tips that he can bring to you, of things that we can empower you to change your health. And I want you to be sure and tell friends of yours about this podcast, because a lot of people won't read a book, and maybe they won't listen to what you have to say. But if you'll just direct them to this podcast and say, listen, you need to hear this, and I really believe your eyes will be open. So be sure and share with your friends and your families about Dr. Colbert's podcast, Divine Health Podcast, and let them listen to what he's saying, because you could be the difference between someone feeling good and someone feeling really bad by just one little thing, directing them here.
Now let me explain something. The vast majority of doctors will not treat a sluggish thyroid. So when you come in with cold hands, cold feet, brain fog, bone tired, real sluggish, real tired, real fatigued, losing your hair, losing your eyebrows, and your temperature is low, guess what they're going to do? They're going to check your TSH. They're going to say, oh, your TSH is normal. It's 3. It's fine. Or it's 4. It's not 4.5. So let's just watch it. We'll just watch it. Well, if you watch it, you're going to feel worse and worse, and you're going to get more and more fatigued, and symptoms will get worse and worse. Your constipation will get worse. Your obesity will get worse. Your fatigue will get worse. Everything will get worse. Your skin will get drier. So that's why I treat my patients. Now, again, I many times start them with Thyroid Zone because it's not a prescription. And sometimes we'll use a little iodine drops. But we find that for those people that are really bad off, they need that natural desiccated thyroid. That natural desiccated thyroid has to be prescribed by a physician. Now, again, if you can't get into a physician, you're in COVID lockdown somewhere or some weird thing's going on, you can call me and we can set up a telemed consultation with
our nurse
practitioner. Absolutely.
Sierra.
We can prescribe that. And if you're older, we start little teeny doses and we tweak it up until we get you to that sweet spot. Now, let me talk about Hashimoto's. And Hashimoto's is the most common cause of low thyroid. That's not sluggish, that's low. Now, that's where your body's forming antibodies that's literally attacking and destroying, slowly destroying your thyroid. Your thyroid's inflamed, and your body's forming antibodies like missiles attacking it, destroying it. So eventually the thyroid will fail. Now, I check that on every patient because I do a TPO level, thyroid peroxidase antibody level. If that level's sky high, like commonly I'll find that level up over 1,000. And that means their thyroid is under full assault by their own immune system. See, it's an autoimmune disease where your body's attacking itself. And if that's the case, if you take iodine, you're in trouble. It'll make it worse, so you don't want to take iodine.
Don't self-prescribe.
Don't. But you can take my Thyroid Zone, or even you can take selenium.
That's safe.
Now, selenium is in my Thyroid Zone, but just a little selenium, 100 micrograms a day, is one of the best things. Some people need 200 micrograms a day. But what that does, that's boost the glutathione peroxidase, which helps to stop the inflammation in the thyroid, and we remove the thyroid-fueling foods that fuel the inflammation. There are 2 key foods generally that fuel Hashimoto's thyroiditis, and most people don't realize it, but people with this disease seem to crave these 2 foods. And number 1 is gluten or wheat, and number 2 is soy. And soy is in most every processed food under soy lecithin, but it's also in your mayonnaise, soybean oil, and it's also in your most all salad dressings except for olive oil.
So soy is an enemy of the thyroid.
If you have Hashimoto's.
Okay.
Not if you have sluggish, because the vast majority of people with sluggish hormone, thyroid hormone, don't have Hashimoto's. They have just sluggish thyroid. It could be from aging. It could be from stress. It could be from poor diet, lack of sleep, hormone disruptors, all the above.
What do you consider a low thyroid? What's a low thyroid?
Where a low thyroid is generally their free T3. If it's in the 2s and they're having these symptoms, they have a sluggish thyroid. Now, if it's less than 2.2 and their TSH is greater than 4.5, that's a low thyroid. Okay? But again, realize most all doctors will not treat sluggish thyroid. They'll only treat low thyroid. So you've got to be feeling pretty bad. And when you do get treated by most doctors, they treat you with the inactive form that doesn't help your metabolic rate. It doesn't help your energy. It doesn't help the weight loss. It's the inactive form or the levothyroxine or the Synthroid.
Wow. So you have just got so much good information, Don. I know people are taking their pen and writing this down, but you can get this information in your book.
Yes, the Hormone Zone. It contains all that. It spells it out beautifully. I give great examples. I give testimonies of patients who've overcome low thyroid, sluggish thyroid, but the vast majority, it's not low thyroid, it's sluggish thyroid, but it makes you feel just as miserable as low thyroid.
We want you to go to our website, drcolbert.com. That's DRCOLBERT. And you can get the book from us, or you can also get the Thyroid Zone from us. And Don, go ahead and...
Well, let me just tell you about a patient. Diane was 60 and she was obese, exhausted, and depressed. She couldn't lose weight even after trying almost every diet for over 30 years. She was so tired and had no energy at all to exercise. But when I first saw Diane, she had a low free T3 level of only 2. Now, normal is 2.1 to 4.4 on the free T3, and that's your active thyroid hormone. Now, doctors rarely check free T3, only very few, less than probably 5%. And Diane also had her TSH checked by many doctors. She was told her thyroid was normal because that's the main test they check. And if that TSH is less than 4.5, they're generally not going to treat you. But yet she always complained of cold hands, cold feet, and she had to wear warm socks to bed every night for 30 years. So I started Diane on natural desiccated thyroid, which I used NP thyroid, 1 grain a day. I rechecked her free T3 blood test about every 4 to 6 weeks and gradually raised her dose up to 2.5 grains a day over a few months. Now, after a few weeks of reaching the dose, Diane called the office. She was so excited. She said that since starting the dose, her energy had increased dramatically, and that's the first thing I usually hear. And another thing she said, the weirdest thing happened, I started sweating. She says, I have not sweated for 30 years, even if I exercise. And I warn people, sweating is good. If you're sweating, that's a good sign your body's heating up. But see, Diane hadn't sweat since childhood. And so she started walking. She eventually got up to 30 minutes a day, 5 days a week. Now, before she had no energy to walk. She couldn't even get out and walk. But for Diane to lose 1 pound was major. But now she was losing 1 pound a week with the healthy keto diet, because I put her on my keto diet with lots of olive oil, with lots of avocado oil, seeds and nuts, not all the butter, cheese, cream, hot dogs, all the junk food that is unhealthy keto. And again, I'm writing a book on this now, but I have a Keto Zone diet book too. But anyway, she lost over 50 pounds after 1 year, which she could have never done before, and she was absolutely ecstatic. But she was able to keep the weight off with her thyroid medicine, her keto lifestyle, and her exercise program, and she's no longer obese. She's no longer exhausted. She's no longer depressed, and no longer has any symptoms of low thyroid, and she is ecstatic. She's got her life back.
Oh, Don, that is so good. That is so encouraging. I hope and pray that this podcast has maybe given some answers to a lot of you that you just didn't know. You know, the Word of God says, my people are destroyed for lack of knowledge. And it's the right kind of knowledge is what is important, that you get the right kind of knowledge. And I have to tell you, because medicine is changing continually and research is changing continually, what may have worked 5 years ago in their research, they find out it may be a little bit different. So right here at Dr. Colbert's Divine Health Podcast, we are going to try to stay on top of what's really new in research, what's accurate, because we are committed to bring you the most accurate information so that you can walk in divine health. Now, you need to get a hold of Dr. Colbert's book, The Hormone Zone.
And I also list doctors you can see or organizations where you can find a doctor to prescribe this. But if you can't, we can do telemed or whatever and help you out, and it's inexpensive.
Now, you have a list in the back of your book?
Because some you can find, some you can't. So if you can't, again, you can always see us or we offer telemedicine.
Okay, so go to Dr. Colbert, that's DrColbert.com, and you can get a hold of the Thyroid Zone supplement and the Hormone Zone book. Because now the next few podcasts, I am so excited because the next podcast we're doing is going to be talking about testosterone. Men and women need to hear this next podcast. Don, I'm telling you, listen, I'm excited about a lot of things you share, but I can't even begin to tell you how the information in our next podcast.
Yes, absolutely. Life-changing
information. I promise you have never heard before. Thank you for listening and joining us.
Absolutely. Blessings to you.
Until next week.
Yes.
God bless.
God bless you.